and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast from the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance Center, or ARC IPC. My name is Elena Kidd, and I'm a program director at the University of Alabama at Birmingham's School of Public Health. Today, we welcome back Dr. Ziad Kazzi, professor of emergency medicine and director of the International Fellowship in Medical Toxicology at Emory University, and associate medical director of the Southern Regional Disaster Response System, to discuss the potential health hazards and safe use of using QATs, hydrogen peroxide, and phenol when disinfecting against COVID-19 and other viruses. So thank you so much for joining us again, Dr. Kazzi.
Thanks again for having me, Elena.
So QATs, or QACs, quaternary ammonium compounds, hydrogen peroxide, and phenol are three common disinfectants used in schools and healthcare settings to clean and disinfect against bacteria and certain viruses like SARS-CoV-2. So if I'm looking at a bottle of cleaner, how would I know which chemical I'm using?
I think usually the bottles of the cleaner that you see in the market, they will actually list the chemical, but you may not be able to recognize what class of chemical it is. The writing may be too small to see easily. So to be really sure what the chemicals are, you do have an Environmental Protection Agency, or EPA, registration number on the label. And that number is unique to that specific product. Now, the Environmental Protection Agency, or EPA, has provided us with resources to look up the specific product components using that EPA registration number on their website. So I invite you to do that when you are buying a product. I think this should be a regular thing that you do, because these products, again, the brand names often make any of these products, any of these chemical products, so then you recognizing the brand name may be misleading. So I definitely recommend learning how to do that, and the EPA has provided videos on how to do that online. Now, I know also that some people are wondering whether these cleaners or disinfectants are effective against SARS-CoV-2, the virus that is keeping us all busy for the last couple of years. And I think a great way to look that up is on the EPA N as in Nancy, N list of disinfectants. That's also available online. You can actually use that EPA registration number in the N list search tool and get all the information you need.
All right, so I guess I'm going to start off with QATs. What products are QATs normally found in?
Quaternary ammonium compounds are referred to as QATs or QACs, QUAC. These are, present in different types of products. They're disinfectants. They're low-level disinfectants. You tend to see them a lot in wipes, but you do also see them as sprays or liquids. And the spray formulation of the QATs needs some special instructions. I'm sure we'll get into that shortly. But again, the best way to know what you are using is to look it up either directly on the label, if you're able to decipher and differentiate, or the EPA registration label using the N list of disinfectants on the EPA website.
And you mentioned briefly, but what are some of those health concerns with using QATs, especially those spray versions?
So, in general, you have to follow the instructions of the specific product you're using, but commonly misunderstood or maybe not followed instructions are spraying the chemical directly on a surface or in the air in a potentially poorly ventilated space. These chemicals, when they are aerosolized in the room, first they may not cover the surface that you're trying to clean well or uniformly, so they may be less effective. And they may also expose people in the room or yourself as a applicator of that chemical to the vapors of these products, the chemicals that can cause asthma, potentially, can exacerbate existing asthma. It can even irritate you and cause cough and chest pain and shortness of breath, burning in your nose and eyes and throat, even without causing asthma. So again, breathing these chemicals in, these low-level disinfectants like QATs or sodium hypochlorite bleach, is going to cause potential problems. Therefore, you need to spray that chemical if you're using a spray method on a rag and then clean with the rag on the surface. Also remember from our previous podcast to clean the surface first, clean the dirt that may contain organic material that can react with chemicals like sodium hypochlorite. It will also prohibit the chemical from reaching the virus. So if you have a layer of dirt, it will protect the virus. So cleaning first is important, using a rag and not just spraying randomly inside the space, and then ensuring proper ventilation when possible to decrease the inhalational exposure to these chemicals. Of course, using the product according to the label, wearing goggles is important, and particularly with QATs and hydrogen peroxide and phenol and bleach, be careful with these in your skin. Quaternary ammonia compounds are sensitizers and can lead to the development of a allergic contact dermatitis. So you handle the quat directly without gloves, it sensitizes you to the quat. Next time you use it, there's an immune response that has already occurred in your body. You formed immunoglobulin E that binds to the chemical, and now you have a allergic reaction with dermatitis. That can also lead to occupational asthma in some scenarios. So therefore, wearing gloves is very important when handling these wipes or these chemicals.
So moving on to hydrogen peroxide, is there a difference between the hydrogen peroxide I can pick up from the grocery store and the hydrogen peroxide used in schools or healthcare settings for disinfecting?
Yes, I think hydrogen peroxide is really interesting in our podcast today because the toxicity that we see from it is usually with concentrated products. Although many of the products you use on a daily basis have very low concentrations. I mean, hydrogen peroxide is even present in mouth gargles. So clearly, it's safe to be used in that way. The issue comes up when you are using a concentrated product or you're using a product inappropriately. For example, you're ingesting a large amount. Even of the less concentrated products, you may develop some toxicity, and it's an irritant that's going to cause similar irritation as if you're drinking a caustic agent, to your mouth, to your throat, to your intestinal tract. The one thing that's unique about these concentrated hydrogen peroxide solutions is they can cause air embolism, and that can cause significant acute toxicity in the liver that may require hyperbaric oxygen therapy. It can also cause these air bubbles to spread air elsewhere in the body other than the liver and cause a variety of clinical symptoms that are outside the scope of this brief podcast. But certainly for toxicologists like me, hydrogen peroxide poses its own acute toxicity challenges.
And so that brings us to our last chemical we're going to discuss is phenol. So what's important to keep in mind when using this chemical? What are some of those acute health impacts from incorrectly using this chemical?
Now, phenol is known to be acutely toxic with these concentrated solutions. There's a historically used solution called creolin, for example. It's interesting for us because it causes, again, the same type of caustic injury when ingested. It can also cause dermal burns that are interesting because they are depigmented as well as anesthetic. So that's kind of unique clinical feature that medical toxicologists always, like to teach about when we are, working with other colleagues or at conferences, for example. Phenol, though, that you see at the healthcare setting being used have low concentrations. So certainly, they are, of course, not as dangerous as these concentrated solutions. But again, using gloves, remembering that these are irritating to the skin, certainly not drinking them, ingesting them. All of these are good measures. Even at these low concentrations, when you drink a lot of something, you can overcome the protection of the low concentration solution and cause toxicity similar to a larger concentration product. So certainly, again, irritating to the skin, potentially to the eyes, protecting the eyes, especially when you're diluting the product and you have a risk of splashes, and ventilating the space, avoiding exposing yourself to these irritant chemicals by inhalation is always, a good measure.
All right, and then is there anything else to keep in mind for folks using these types of chemicals about how to use them safely and effectively? I know that you've mentioned, not spraying them directly on the surface, making sure that you're following the directions on the product, using gloves, masks, goggles.
Storing them safely. I don't think we've talked about that during our podcast, Elena. That's always an important thing to remind parents and teachers and uh, people that work with these chemicals on a regular basis. these bottles can look attractive to children. They can also, some adults even occasionally may drink them. Don't transfer them into a bottle of a soda bottle. Don't transfer them into a cup. We see a lot of people that run into these unintentionally. And of course, you have the whole intentional piece that we're not going to recover today. I also want to add that we've had questions come up with women that are pregnant or breastfeeding. So I think those two situations require maybe a comment today with these chemicals. Luckily for us, quaternary ammonium compounds, phenol, and hydrogen peroxide do not have any direct evidence that they cause toxicity to the fetus or cause any issues with breastfeeding. So that's good news regarding these three chemicals. Also, when you think about the environment and how you want the environment to be safeguarded from chemicals that end up in wastewater, it's important to remember that these require a lot of research to really assess their environmental impact. But in general, there's always some environmental impact from chemicals that are ending up in our wastewater or treated water. And the Environmental Protection Agency does have a list of design for the environment, or DFE list of chemicals. And in these, based on what they do to the environment and to human health. And I just want to say that of the three chemicals we talked about today, quaternary ammonium compounds and phenol would be considered more on the more toxic side from that perspective by the DFE list of EPA, and hydrogen peroxide will be on the less toxic list. Just something to keep in mind in general. But as long as you use these safely, according to the label, I think they will disinfect your environment from SARS-CoV-2 effectively and safely. So there's definitely a way to use them without any concerns.
All right. And thank you so much, Dr. Kazzi. That was excellent and very important information that everyone right now at this time needs to hear. So we really appreciate you being here and talking with us about safely using these chemicals.
Thank you.
And I know we're going to have you back in future podcasts to talk about the safe use of hand sanitizers. So we're looking forward to that as well. So until next time, thank you to our listeners, and please tune in for another episode from Standard Precautions and Beyond, Conversations in Infection Prevention and Control.